Well, SARS is one of the infectious diseases that really changed how we approach controlling diseases worldwide.
Before SARS, there were no real good diagnostic tests to be able to identify what was causing respiratory infection. So when people got sick and died and they had no diagnosis, they just died.
SRAS, 4 lettres pour désigner le syndrome respiratoire aigu sévère qui a touché près de 8000 personnes dans le monde et causé la mort de 750 patients. Aujourd'hui, 10 ans après l'apparition de cette épidémie en Chine, les organisateurs d'ICPIC 2013, la Conférence internationale sur la prévention et le contrôle de l'infection, ont souhaité revenir sur cet épisode majeur qui a changé les mentalités, mais aussi et surtout la prise en charge des populations touchées par une épidémie.
What SARS told us is that we really have to move into the 20th century, we have to move into the 21st century, and we have to think about how do we cooperate, how do we set up communications, how do we jump on infections very quickly. And that's what SARS really made clear to everybody. And so for many of us, SARS is kind of an important event, what the world was like before SARS, and then what public health and medicine was like after SARS.
Aujourd'hui, 10 ans après, le monde médical a évolué et a pris conscience du nécessaire contrôle de l'infection dans les hôpitaux et les établissements de soins pour protéger les patients, mais aussi le personnel soignant, premier touché par la contagion.
We are now 10 years later and the same family virus is causing us problem in the whole Arabic Peninsula with a new coronavirus.
The MERS-CoV, or the novel coronavirus that was first discovered in September 2012, has so far affected 70 people and caused 40 mortalities. The virus is a novel virus. It belongs to the corona group, and we know little about it so far, but we're learning much every day about this virus and the way it causes disease. The virus seems to be less virulent than the SARS virus, and the transmissibility of the virus is not as rapid and as fast as the SARS virus.
Beaucoup de questions et de doutes planent encore autour de ce nouveau virus. Mais aujourd'hui, le monde médical a acquis de nouveaux réflexes, comme l'hygiène des mains et l'application stricte des précautions air et gouttelettes recommandées par l'OMS. Des gestes simples, essentiels, qui permettent aux professionnels de la santé d'observer ces nouveaux virus sans en avoir peur.
Well, I think we have to be conscious about it, but I don't think we have to be afraid. There's no need to be paranoid, but I think it's a good and timely reminder of many of the lessons we learned during SARS. Is that good infection control will protect you against what you know and also against what you don't know.
We are certainly more confident because we lived SARS, which was a coronavirus. We learned how to handle this situation, and now we are facing a new coronavirus, but the mode of transmission is certainly or almost surely the same. So we have learned from SARS epidemic 10 years ago, and we are more confident.
Encourager et accompagner le contrôle de l'infection partout dans le monde, c'est la mission d'ICPIC. Innover, imaginer des solutions pour demain, un défi et une ambition, au cœur des débats et des échanges de ce rendez-vous 2013 à Genève.